But we begin this morning with the news that our region's biggest and most well-known hospital system will have a new name. Take a look.
Welcome to the world, Austin Joseph.
This new TV ad shows off a New Year's baby born at the Long Island Jewish Medical Center on the Queens-Nassau border, and it also shows off the North Shore-LIJ Health System's new name.
Northwell Health. Look north.
The hospital system's president and CEO says after years of discussions, it was finally time to reflect the system's major expansion beyond Long Island's borders.
The system was named after two of our hospitals, North Shore and LIJ, and now we have 21 hospitals.
This map shows the health system's growth over the last decade into the city and the boroughs, including Staten Island. And the north part of the new name reveals plans to further expand into New England.
Up into Westchester, up into Connecticut and Massachusetts. I think that's a potential.
Dowling adds the health system's 21 hospitals will still retain their original names, with Northwell Health just being added on. But it's clear that longtime patients are not sure what to make of it.
Northwell? Are you kidding me? That's silly.
I don't know. I think it's going to confuse a lot of people.
For years they've heard North Shore, and now Northwell. What is the difference?
The system's administrators say the difference is the new name will emphasize wellness, and some patients get that.
I like the name, but I understand that it's more descriptive, the new name. Northwell, and that's what they try to do, get you well in this hospital.
And that's what they try to do. Now, joining us now is Michael Dowling. He's the president and CEO of Northwell Health, formerly North Shore LIJ, or maybe a combination. We'll figure that out. Welcome to the show, sir.
Thank you so much.
So you heard some of that. What's been the reaction you're getting to the name change?
The reaction so far has been unbelievably positive, extremely positive, in fact, both from the employees and from the communities that I travel in. The feedback across the board has been mostly very, very positive.
Yeah, because you kind of get a different reaction from people who are outside the region. You heard some of the folks in our story there. They're worried about whether this is going to cause confusion or if it's just all about marketing.
Well, remember, we just started with the new name about 2 weeks ago. So you have to anticipate that there will be a little bit of confusion by some people at the beginning. This will take a period of time to get right. We will continue to communicate. It shows like this, by the way, are very, very helpful in getting the message out. So
there you go.
We really appreciate, because without shows like this, we wouldn't be able to get the message out as successfully as we would like to.
All right, so you're probably right. Over time, people will get used to it, and there have been changes in your hospital system over the last decade where there have been some names added on, and so people have been through this before. What difference does this make to the average person, though? Is it just about marketing, or is there more to this?
Well, it's a combination. Obviously, when you go outside the Long Island area, which we have been doing for the past 10 years, the new name represents the totality of a bigger organization than what we were 10 years ago.
Yeah, explain to folks how much it's expanded, because I didn't even have time in that story to talk about all the places that
we're in
you've gone.
The complete metropolitan area. We're in Westchester, in Staten Island, in Manhattan, in Queens, in Brooklyn. In discussions in other areas outside of this region.
Well, that could be news. Well, what can you tell us there?
Well, we're in discussion with some entities in New Jersey, for example. Whether or not that occurs or not, I don't know yet. We're in discussions potentially with people in Connecticut. That may or may not occur. One of the things that we can be sure of is that as the consolidation in the healthcare field continues, we will continue to expand.
Well, let's talk about that. Consolidation, mergers, people are seeing this, and, you know, average folks tell us, what's this going to mean? That we have this big system now, we're going to have less choice, we're going to pay more for all this?
Well, the benefit of a large system is to be able to coordinate care better, pull all of the various pieces together. For example, we have in our health system, we have everything from primary care to hospital care to ambulatory care to long-term care to insurance and to post-acute care, post-hospital care. So people will be moving from parts to parts within the health system, so you're able to coordinate it better. That is much better than it was in the prior years when you were just only focused on the hospital itself, especially as more care is now being delivered outside the hospital.
Yeah, you know, it's all part of this evolution, revolution. You have critics and supporters on all sides, become politicized in so many ways that the medical field wasn't used to being involved in, as people have either loved Affordable Care Act, Obamacare, or critics call it. But it's changed the whole world of how you have to do it. It's called managed care, wellness, no longer the fee-for-service, trying to create a coordinated, integrated system. How's that going to change the world for people who are trying to get well?
Well, if it is done correctly, and there are multiple pieces to to this. If it is done correctly, the goal is to have better outcomes for people at the end of the day. More prevention, more wellness programs, shorter lengths to stay in the hospital when you don't need to be in the hospital, better coordination of care that I mentioned before, improved outcomes, better service, and over time, hopefully, reduce cost.
Yeah,
the
that's
whole
part
idea is to reduce the cost and improve the quality.
Yeah, that's part of the philosophy you were saying about trying to get bigger, is because you got so many components now that the federal government wants integrated.
The whole idea is integration, especially as more and more care, because of advances in technology and advances in science, moves the location of care away from the walls of the hospital, from inside the walls of the hospital.
Well, I talked about how it's, you know, politics working their way into the medical world, something you weren't used to. How big of a challenge is this? Because I know, you know, there was probably some grudging resistance at first, because people are like, how are we going to change into what you want us to be? Is this something that's achievable?
Oh, absolutely. And it's a complex business because you're dealing with the totality of a person's health. You're dealing with changes in the way the government pays and the way insurance company pays. But it's an opportunity for innovative organizations, and we consider ourselves a very innovative organization, to get the best results and do it better and prove that it can be done.
Well, you know, and I say we don't want to draw you into the politics, because that's not the world you operate in, but then you hear folks saying that if the power changes in Washington and it becomes a Republican control, that they're talking about undoing a lot of what we've seen under President Obama. Would that make this, I mean, what would that do to everything you've tried to achieve, to be part of it, if it gets undone?
I think it'll frustrate you around the margins, but at the core of what we're all about, we're going to follow what we think is the right thing to do. And obviously, we'll have to comply with any new requirements that come on. But I don't think there'll be any massive disruption. I think there'll be changes around the edges. And we just have to deal with that. That's part of being in a business like this.
Now, you have your own health insurance exchange on the state exchange, and we've seen the controversy that's occurred with some of the subsidized ones failing, and a lot of doctors didn't get paid from Health Republic failing. And then the choices now are less than they were, and the premiums have gone up. What's been the experience for your health insurance?
Well, our health insurance entity called Care Connect has increased its membership dramatically over the past number of months. We're continuing to grow. So far, it's been quite successful. The satisfaction of the consumers that buy health insurance from us is unbelievably positive, but it's in its infancy. It's going to take a period of time for this to flush itself out over the next number of years.
There you go. Well, Michael Dowling, President and CEO of Northwell Health. That's right, Northwell Health. Thanks for explaining the name change for us today.
Thank you so much.